Hello, you all. Once again, I am Jasmine Rutherford, and this will be my role play on the family case we were provided in week 2 of our discussions, where I will describe 3 different segments. In each segment, I will implement techniques of structural family therapy just to kind of guide, well, using the case example as a guide. Just before I start, I want you all to know that I have named the characters that were provided throughout that case example. So Lisa will be the daughter that overdosed. Janet will be the mother. Thomas will be the father. And the son will be Lincoln, the 17-year-old older son. All right, you guys. And the first segment will be the first meeting in terms of laying out the goals and structure of the family therapy session and how I will gain the family's trust by joining them. All right, hello you all, and thank you all for joining me today. My name is Jasmine Rutherford, and I'm here to help you all work through any conflicts that you all may have experienced recently as a family. So before we begin, I would like to get to know everyone a little bit better by understanding why each of you all believe that you are here today. So I would like to start with you, Lisa. I understand that you really haven't been feeling yourself lately. Is that correct? Okay. Well, what do you feel is different about how you feel now versus how you felt in the past couple of years? Okay. Well, would you consider yourself depressed? I know that that's kind of been a term that's been going around, so I just want to know that you personally feel that you are depressed. Okay. Well, I agree with you that such feelings are kind of difficult to understand or even explain to others. So, hopefully, we'll be able to kind of tease your feelings apart and discover some of the reasons behind your depression or what you consider to be depression. How would you like if we move forward like that? Alrighty, well, I will do my very best to help you move forward and to overcome these feelings that we will later discuss. Alrighty, so now you, Janet, you are the wife and mother of this family, is that right? All right, now why do you personally believe that you are here today? Okay, so as I understand, you were shocked, like many mothers are, about your daughter Lisa's drug overdose, and you would like to better understand how we can make sure it doesn't happen again, correct? Okay. Well, I completely understand your concerns. Do you have any prior experiences with depression? Anything that may have happened in your family? Okay. Well, although this situation is very unfortunate, I do believe that your personal experiences with your father and your sister's depression can really be useful for Lisa here. And, you know, she may feel as though no one knows what she's experiencing. So, like I said, those experiences that you have may be able to help her get through it. Alrighty, well, let's speak to you for a second, Thomas. Excuse me, were you shocked as well by your daughter's overdose? Okay, I'm sure you were. So, what would you like to see happen from our sessions and the times that we meet? Okay, I got it. So, similar to Janet, you would like to understand how you can help Lisa as well, not become depressed, and kind of develop a stronger relationship where she feels as though she can come to you whenever she feels that she's in a dark place, correct? Okay. Alrighty, well, I completely understand where you are coming from as well. So how about you, Lincoln? Why do you feel that you are here today? Okay. So from what I understand is that you believe you're here by default as a result of your sister's overdose. So is there anything that you in particular would like to see happen from our therapy sessions? Okay. Well, I understand why you would be angry, especially, kind of how it worried everyone in the family. So I definitely understand where you're coming from. But hopefully we will all be able to make some adjustments so that situation will never happen again. Are you all open to that? Okay. All right. Well, it sounds as if everyone would like to do whatever is necessary to ensure that Lisa does not resort to drugs again. So I find this to be a great sign, and I would love to help you all overcome this minor setback in your family. So let's start by discussing everyone individually. Okay, you all, that was the first section. In the second segment, um, this will be interruption of any bickering or blaming that may be present between, well, when referring back to the case example, I know that Lincoln, who I've named Lincoln the son, is angry. So this is just an example in case things get a little heated of how I would approach the situation. Okay, everyone. Thank you all for sharing your inputs. Now, let's all take a quick moment to relax and ease the tension. Let's do a quick breathing exercise. Everyone, close your eyes. Take a deep breath in and slowly count backwards from 3. Are you all ready? All right, close your eyes. Deep breath in, count backwards from 5. I'm sorry, not 3. 5, 4, 3, 2, 1. Okay. Does everyone feel a little bit better now that we've taken a breather? All right. Well, that's a start. So thank you all for showing me firsthand what are some of your triggers to these arguments. Now we will be able to better address these topics if they rise again, just because, you all have shown me firsthand exactly what some of the triggers are. So before we proceed, I want you all to know that no one is at fault or wrong for expressing themselves. During our sessions, I want everyone to feel comfortable enough to discuss with me and each other their true emotions. Now let's explore some of those triggers we've just experienced. All right, you guys, that was my second segment in the event that an argument took place. And the third segment will be how I will end the session, including any type of homework or task that I suggest to the family and any type of goals we may set. All right. From our session today, I see greatness in you all, in each and every one of you all. All of you all contribute characteristics that are needed not only in this family but to one another. And as you all continue to kind of work on your communication with Lisa as well as each other, you all will be able to understand one another and respect each other's perspective at the same time. Okay, now before we end, just a couple of questions. Lincoln and Thomas, aside from what you all have witnessed with Lisa as your sister and as your daughter, do you all understand what depression is, or have you all ever experienced it before personally within your immediate family or extended families? Okay, well, before our next session, I would like for each of you all to conduct some research on depression just to get a little bit more clarity on how it affects us as individuals. And it's not really something that we'll discuss in full detail that you all have to paraphrase and bring back to me, but I do want you all to kind of gain clarity since you all haven't had any type of immediate experiences with it. Like I said, this might help you all understand what Lisa is experiencing a little bit more. Now, for you, Lisa, I have a quick little task that I would like for you to consider. I would like for you to make a list of some of the activities you enjoy doing with your family. It could be something simple like eating dinner together, or even something extravagant as going out spontaneously, whether to an amusement park, to anything that you really consider fun. If you don't mind, I would like for you to make that list, jot down a couple of quick things, and post it somewhere so that the family can see. Somewhere like your refrigerator would be nice, just so everyone can kind of have an idea of some of the things that you enjoy, when we weren't in such a dark place. And this way, I would like for all of you all to try to do some of these things from the list at least once a week. This is in hopes that Lisa will start to open back up with everyone and won't feel as neglected or isolated. Isolated is a better word. As isolated as she may have felt in the past few months and weeks, and that you all will get as close as possible to the life that you all had prior to the overdose. So during our next session, we will discuss any changes that you all have experienced as a result of, these tasks and these activities that you all have enjoyed as a family. Are you all open to that? Okay. Well, I look forward to hearing about these activities and how much fun you all have as a family. Is there anything else? All hearts and minds are clear? All right. Thank you all, and I will see you all during our next session. All right, those are my 3 segments.